we can start the session.
Should I start?
So, good evening to all the viewers. We at Osteoporosis and Arthritis Care welcome you all for today's session.
You will not give my introduction? You will not.
Osteoporosis is a condition where bones become weak.
Okay.
Dr. Vijay sir, Nildipta sir is starting. Please wait, sir. Yeah, Nildipta sir, please start.
Okay, friends, brothers all over. Good evening to everybody.
Dr. Vijay sir, can you hear me?
Yes, I am listening.
So once again, good evening to all there. Welcome you all for today's session.
Thank you very much.
Osteoporosis is a condition where bones become weak and fragile, increasing the risk of fractures. It often develops silently over time and usually diagnosed only after the fracture occurs. And over 50 million of Indians are estimated to be either osteoporotic or have low bone mass. 1 in 2 women and 1 in 4 men over age 50 are likely to suffer osteoporosis-related fracture in their lifetime. So today, with the objective of discussing drug selection in medical management of osteoporosis, we are joined by Professor Dr. Vijay Kumar Khariwal. He is a very senior orthopedic surgeon and has worked from ground level village dispensary to the best hospital in India and abroad. Doctor has special interest in osteoporosis and has been an overseas invited speaker in various countries in national and international conferences. Doctor has visited Pakistan, Nepal, Bangladesh, Bhutan, Sri Lanka, Thailand, China, Dubai, Oman, Muscat, Saudi Arabia, Sweden, Rome, Prague, Cape Town, South Africa, Spain, and Madrid, Montreal, and Canada. So Doctor has been widely experienced and Doctor has been visiting professor in Nepal, Kathmandu University. So join us in welcome our distinguished guest as we embark on this enriching conversation for your health and well-being. So welcome to the program, Dr. Vijay Khariwal. Please enlighten your thoughts.
Yes, please. Thank you very much for your comments. Friends, good evening to everybody. Sabko namaskar. I am starting with my topic. A very common all over the world, most common orthopedic problem जो हड्डियों की एक प्रॉब्लम होती है कि 5 साल की उम्र के बाद जिसको हम एक सिंपल भाषा में कहते हैं कि हड्डियां खुरने लग जाती हैं. That term is given to osteoporosis. And today we are going to discuss more stress on the management of the osteoporosis, bone health, and various drugs which are used for osteoporosis. Friends, it is a very common saying, जो आके ना जाए वो बुढ़ापा देखा और जो जाके ना आए वो जवानी देखी. The treatment of osteoporosis means delaying your old age symptoms. बुढ़ापे को जितना डिले कर सकते हैं और आप सबको हेल्दी रखना. That is what is the aim of our treatment. And now, fortunately, we have developed, the science has developed many drugs which definitely keep the person healthy. I am reminded of our former Prime Minister, Vijay Kumar Khariwal, his poem कि हे मेरे प्रभु, अगर आधी रात को भी कोई मेरे घर के बाहर दस्तक दे तो इतनी क्षमता रखना कि जीवन के अंतिम क्षण में भी उठ के खुद दरवाजा खोलूं. तो फ्रेंड्स, हमारा जो मेन जो इसका उद्देश्य है आपको बताने का कि बुढ़ापे के अंदर, नॉट इन द ओल्ड एज, आफ्टर द एज ऑफ 50, 60, 70, हम आपको कैसे एक हेल्दी जीवन प्रोवाइड कर सकते हैं ताकि आप किसी तरह की तकलीफ महसूस ना करें, जीवन के अंतिम क्षण तक आप इंडिपेंडेंट रहें, किसी पे डिपेंड ना रहे, मोहताज ना रहें. ये नहीं कि आपको बाथरूम ले जाने के लिए भी 2 आदमियों की जरूरत पड़ती हो. दैट इज व्हाट इज द मीनिंग ऑफ दिस ट्रीटमेंट ऑफ ऑस्टियोपोरोसिस. आई एम स्टार्टिंग विद माय टॉक. फ्रेंड्स, दिस इज द टॉपिक, introduction, diagnosis, osteoporosis, and what are the medicines we can give. You look on the right side, these are the horses. So till the end of your life, you should run like horses. That is the aim, and it's possible now. This is my photograph about 60 years, 50 years back, and look at this side. Nobody will like this. Due to osteoporosis, one should become like this. This picture we rarely see now. But if not treated, few of the patients go to extreme thing that there is a kyphosis, patient bends and cannot see further. She needs the help of a lady. So we want in the evening of your life, you should lead a comfortable, independent, good life. I will show you the next photograph of a patient who is taking treatment and you will appreciate how healthy he looks. Now look, we want the last few years of your life should be colorful. This is Niagara Fall seen in the evening. Look at the beautiful colors. And this gentleman is taking treatment for osteoporosis. He is 80 years old. Can you say that he is 80 years old? No, he is independent. He is rising the stairs and doing every activity independently. He looks like of the age of 60. So that is the aim. These are the prices the person has to pay because it is a painless disease. So people say it is painless, but it's not that painless. Patient remains uncomfortable. Mild body aches occur, which even are not given in the literature, and the person usually presents with major fracture, and the most dangerous are the fracture around the hip. And in the end of the life, about near the age of 80, if such fractures occur, more than 50% of the patients they die in the after 1 year, within 1 year of these fractures, even after treatment. And the life is never normal before the fracture. These are the common sites where fracture occur in the spine, the lower end of the forearm, जो बाजू का प्लाई के पास का हिस्सा होता है, वहां पे हड्डी यूजुअली टूट जाती है. और ये हमारी मेडिकल साइंस के हिसाब से ये हेल्दी बोन है और इधर ये ऑस्टियोपोरोटिक बोन है. हड्डी जो है ना, इसको हम सादी भाषा में कहते हैं कि खोखली हो जाती है. You look at this side, the bone has become porotic. It is not only quantity of the bone decreases, it is the quality also decreases, and the bone becomes fragile, easily fractures with a mild trauma. So now the scientific talk we are talking, osteoporosis means porous bone. It is a disease characterized by low bone density and deterioration of the bone tissue. Low bone density and deterioration. कि bone architecture भी खराब हो जाता है. As the bone becomes more porous and it becomes fragile also. Look at this. This word is very important. That bone is fragile and the risk of fracture is greatly increased. The loss of bone occurs silently. It is a silent disease. Silent thief, this is called. And progressively, often there are no symptoms until the first major fracture occurs. And many times in the spine, fracture occurs, and the person is not even aware of the fact that a fracture has occurred. These patients are grade 4 osteoporotic patients. They definitely need aggressive treatment. Now, it is 1 out of 3 female and 1 out of male in India after the age of 50, they suffer from osteoporosis. This is the same that the osteoporosis correct low bone density and other things. Now, as per WHO definition, the bone mineral density, which is a gold standard for diagnosing osteoporosis, when the deviation is more than minus 2.5 with the same with the young adult, deviation is more than minus 2.5, then T-score is, then it is called a frank osteoporosis. If it is below -1, it is a normal bone. Between -1 to 2.5, it is called osteopenia. That means the quantity is less, but it is not that much that it can lead to fracture. And this is the ideal stage where we should treat this patient. And I will tell you one thing, that osteoporosis, now it is beyond doubt, it has been accepted that osteoporosis is a disease and it has treatment. Previously, it is a routine part of our day. As we become aged, the osteoporosis is bound to occur, but it is not like that. It has improved beyond doubt that if we give proper treatment, osteoporosis will be prevented, and prevention is better than treatment. Once established osteoporosis, the bone never becomes normal. So this is again, we say that DEXA bone scan is the gold standard, but a false normal report comes especially in the spine, because in the spine there are, due to aging process, extra bone forms. So that gives a wrong report. That gives a wrong report, and the most common cause of this false normal is most common cause is because as we grow older, there is calcification in the atherosclerosis, calcification in the aorta. This is the major blood vessel in front of the spine. So in such cases, you can see the X-ray picture. The bones are porotic, but even then the T-score will come normal. That is a false normal report, and the most common cause for false normal report is old age. This is the calcification of the aorta. So in such patient, if it comes normal, even then you start with the treatment. Friends, one should never lose the hope. The most beautiful thing in life is to build a bridge of hope on a sea of despair. कितनी भी मुश्किलें क्यों ना आ जाएं, हमें जो अपने उद्देश्य के लिए हिम्मत से काम करना चाहिए. This is the global burden which is shown over here. According to WHO, this disease affects approximately 6.3% of the males above the age of 50 and 21.2% of the female. This is global. Based on world population, one can easily say that this affects around 50 crores people in the world. And by 2050, the world incidence of fracture in man is projected to be increased by 310% and 240% in women compared to the rates compared with 1990. Worldwide, 1 in 3 women over the age of 50 will experience osteoporotic fracture, as well 1 in 5 men above the age of 50. They vary according to country, but this is the rough. Now, this is diagrammatically shown. 1 in 3 women above the age of 50, and 1 man, 1 in 5 above the age of 50 will experience an osteoporotic fracture in their life. And one thing more I will like to add: once a osteoporotic fracture occurs, if we do not give the treatment for osteoporosis, then there are very great chances that within 1 year the person is bound to get another fracture. This global burden of osteoporosis, Asia Pacific by 2050, about 1.3 billion people in Asia will be aged 60 years, and over about 1/4 of billion, that means roughly 25 crore will be aged above 80 years. Half of all the hip fracture will occur in Asia by 2050. You can well imagine the burden on the society it will, and also on the government. In 2000, just 9.1 out of 100 people were aged above 65 years. This number is expected to triple by 2050 and 4 times by 2100. In the 22nd century, it is going to be like this, because the life expectancy increasing, so the old age people will also increase. Now, our country, India, is home to about more than our population is 1.3 billion, and approximately 230 million India, they are above the age of 50 years. Most data on the prevalence of osteoporosis among women in India come from studies conducted in small groups across the country, and it estimates that by 2050, 20% of the 230 million Indian women over the age of 50 will have osteoporosis. Please understand this. 230 million people, out of 230 million, 20%. This means 1/5 of this, about 45 million people, women, they will be suffering from osteoporosis. That is, the figure comes around 4.5 crores. Prevalence of osteoporosis ranges from 8 to 62% in Indian women at different age groups. The prevalence of osteoporosis in male older than 50 is also variable, ranging from 8.5 to 25% roughly. A risk factor is anything that increases your chance of getting a disease. Having 1 or more risk factor not mean that 1 or 2 risk factors is present. That does not mean that the person will have osteoporosis. So there are multiple factors: your dietary intake, and when you are not exposed to sunlight, your sedentary habit. If you don't walk daily about 1 to 2 kilometers, 3 kilometers, you are definitely bound to have osteoporosis. Then patient with diabetes, patient with thyroid problem, patient taking anti-epilepsy drugs, patient who are smoking, who are drinking, all these factors they lead to osteoporosis. However, the more risk factors you have, the greater the chances of developing this disease. Bone loss due to osteoporosis happens without any symptom. That is a very important aspect. That's why we say a person must have some problem in the body. Only then he will approach the doctor, like difficulty in walking, like pain in the body, or something else. Otherwise, person will land with major fracture, and only then he will consult the doctor. The only two visible signs that they are include that here माय डियर फ्रेंड्स, आपको ये बता देता हूं मैं कि जब इन लेडीज के अंदर खास करके एज के साथ जब उनकी हाइट डिक्रीज करनी शुरू हो जाती है 4 सेंटीमीटर इन ए ईयर, धीरे धीरे क्योंकि जो स्पाइन होता है वो बेंड करना शुरू हो जाता है और उसके साथ साथ तो हाइट कम होनी जो शुरू हो जाती है, that is an strongest indication that the person is having osteoporosis. Look on this side, right side, development of a stoop or curved upper back. ये देखना hump निकल जाता है, हुक हो जाता है, हिप लेके चलना पड़ता है, सीधे सामने देख नहीं सकते. So that should raise the suspicion, not only suspicion, it is almost a certain sign that the person is having osteoporosis, not developing. The person is having osteoporosis, so they must get the treatment. Now, osteoporosis risk factors which are important, when we should suspect, जब इंसान की एज 60 साल से ज्यादा हो जाए, खास करके लेडीज के अंदर, और इधर से जो अगर आपके परिवार के अंदर हिस्ट्री है कि फ्रैक्चर हुए हैं विदाउट ट्रॉमा या घर में फिसल के मेजर फ्रैक्चर हो गए, ऑल दीज इंडिकेट दैट you have family history of osteoporosis. If the person has previous history of fracture, this means that fracture occurred. जितने भी ये osteoporotic fracture हैं friends, ये घर के अंदर ज्यादातर बाथरूम में फिसलने से, लाइट ना प्रॉपर होने की वजह से, ठोकर खाने से नीचे गिर जाते हैं तो इमीडिएटली फ्रैक्चर हो जाते हैं. कहने का भाव ये है कि एक छोटी सी चोट के कारण, चोट तो होती भी नहीं, जस्ट एक इंसान फिसलता है और साथ ही साथ में एक मेजर फ्रैक्चर बॉडी में हो जाता है. एंड समटाइम्स दैट फ्रैक्चर प्रूव्स fatal फॉर द पर्सन बिकॉज in old days there are many other diseases usually associated. Many patients they are having heart disease, many patients are diabetic, many patients have liver failure, kidney failure. So the complex situation makes it difficult for the person to come out of this trauma, and they are not fit for anesthesia also. हम उनका ऑपरेशन भी नहीं कर सकते, और इस स्थिति में ऐसे लोग अक्सर बेड रिडन होकर उनकी मौत हो जाती है, which is very painful. Such death can be avoided. Just like menopause जब आता है, जो औरतें होती हैं उनके अंदर जब मेंसेस बंद हो जाते हैं तो राउंड अबाउट द एज ऑफ 50, लेकिन बहुत सारी औरतें ऐसी मिलेंगी आपको जिनकी के बच्चेदानी ड्यू टू वन रीजन और दी अदर निकाल दी जाती है, कईयों के साथ में ओवरी भी निकाल दी जाती है. एंड इट इज वेरी पेनफुल दैट इफ यू आस्क देम, they are not taking hormone replacement therapy, and if the ovaries have been taken out in the pre-menopausal early era at the age of 40, 35, 37, such patients they are bound to get osteoporosis, and one should be careful. And there are medications, certain medications are there, दवाइयाँ हैं, जैसे epilepsy की दवाई है जो clotting mechanism के लिए दवाई लेते हैं, thyroid patients जो हैं, in all such patients due to and the most important and the most common medicine which leads to secondary osteoporosis is steroids. वो आप किसी भी कारण लेते हैं, जैसे रूमेटॉइड के पेशेंट हैं, ऑटोइम्यून डिजीजेस के, उनको हैवी डोजेस कई बार स्टीरॉइड के देने पड़ते हैं, एंड दे डेवलप्ड ऑस्टियोपोरोसिस, एंड स्टीरॉइड इंड्यूस्ड ऑस्टियोपोरोसिस is a very resistant form of osteoporosis. It responds to very costly drugs and has to be given for a very long time. So this we have to keep in mind. So osteoporosis management of various drugs which are to be given. फ्रेंड्स, सबसे पहले जो बेसिक ड्रग्स हैं, बेसिक ड्रग्स कौन सी हैं कि हड्डियों में जो कैल्शियम जो है पूरा जाना चाहिए, उसके लिए क्या है कि विटामिन डी पूरा होना चाहिए, सनलाइट पूरी मिलनी चाहिए। तो ये चीज है कि कैल्शियम एंड विटामिन ये तो चाहिए ही चाहिए आफ्टर द एज ऑफ 50, इवन आफ्टर द एज ऑफ 40, ड्यू टू द प्रेजेंट लाइफस्टाइल हम सारा दिन धूप तो हमें लगती नहीं, अंदर बैठे रहते हैं, विटामिन डी कहाँ से बनेगा। तो इस स्थिति के अंदर इवन आफ्टर द एज ऑफ 40 और 45, the person must start with calcium and vitamin D and zinc and magnesium also. These all minerals, they have got an important role. And then comes हाइपोकैल्सीमिया। कई बार क्या होता है कि कैल्शियम की कमी होती है और एक बीमारी होती है ओस्टियोमलेशिया, जो कि ओस्टियोपोरोसिस से डिफरेंट है। तो इनके अंदर भी हमें कैल्शियम तो देना ही पड़ेगा। ओस्टियोमलेशिया में और बच्चों में रिकेट्स होती है तो उनके अंदर तो हाइपोकैल्सीमिया होगा ही होगा। बोन जो होती है, बोन का जो मैट्रिक्स जो होता है वो नॉर्मल होता है, लेकिन वो कैल्सिफाइड नहीं होता। ओस्टियोपोरोसिस में क्या होता है कि बोन जो है, जितनी बोन है वो टोटल क्वांटिटी कम होती है, लेकिन जितनी है दैट इज नॉर्मली कैल्सिफाइड। तो हम अगर कैल्शियम तो इसमें भी देंगे, वो इसलिए देंगे कि ओवरऑल बोन को बनाने के लिए। एंड इट इज ए पेनलेस डिजीज। ओस्टियोमलेशिया जो है दैट इज ए वेरी पेनफुल डिजीज। Osteoporosis is very resistant to treatment. Osteomalacia responds very quickly to the treatment. So that is the basic difference, how we differentiate between osteoporosis and osteomalacia. Both are related with the metabolism of the bone, but the mechanism is different. Then, as the person grows old, in male, this male sex hormone decreases, and in female, the estrogen and progesterone, they are decreasing. So for either, this is called hormone replacement therapy. One drug is there, raloxifene, and estradiol and estrogen preparation we can give, but we have to be careful. Estrogen preparation, they increase the chance of cancer in the uterus, so that we have to be little bit careful. Another drug is, then there are specific drugs for osteoporosis, and the first line of drug is bisphosphonates. And among the bisphosphonates, there are 4 or 5 drugs. Alendronate sodium, this drug is given weekly for prevention and treatment of osteoporosis. 70 milligram weekly tablet. Then ibandronate, this is also given for osteoporosis. This is given once in a month. Zidronate, this is also given weekly. And ibandronate comes in both injection and tablet form. These 3 are only tablet. Alendronate and zidronate, they are only tablet form. One is zoledronic acid. This is also given in osteoporosis, and compliance is maximum with zoledronic acid, because this is a yearly one injection has to be given 5 milligram, and this is very effective. These drugs have got a few side effects that I will tell you later. One is bisphosphonate induced fracture, the most serious. Then on the kidney they can have, then avascular necrosis of the jawbone, that can lead to the problem. But it is because they are so rare, so in the literature exact data is not available, but usually 1 or 2 patients in after 1 or 2 about 1,000 patients we see. This is also the treatment part is given. These are anti-resorption the bone, जो कैल्शियम बोन में से बाहर आता है, अगर वो बढ़ना शुरू हो जाए, वही काल ओस्टियोक्लास्टिक एक्टिविटी जो बढ़ जाती है, तो उसके अंदर हम देते हैं हार्मोन रिप्लेसमेंट थेरेपी, कैल्सिट्रोल, बिस्फॉस्फोनेट, बिकॉज दे विल इनहिबिट द ओस्टियोक्लास्ट। ओस्टियोक्लास्ट वो होते हैं सेल्स बोन के अंदर जो बोन को डिस्ट्रॉय करते हैं, कैल्शियम को बाहर ले जाते हैं। थायरोक्सिन जो है, जिनको हाइपरथायराइडिज्म के पेशेंट होते हैं, उनका जो थायराइड ज्यादा एक्टिव होता है तो वो ओस्टियोक्लास्ट को भी एक्टिव करता है। ग्लूकोकोर्टिकोइड, ग्लूकोकोर्टिकोइड्स ranks they are required for osteoclast formation. These are the chemicals on the bone which activate the osteoclast formation, which ultimately leads to destruction of the bone or resorption. And the denosumab drug, which has come recently, and it is given 6 monthly injection. They act by inhibiting the this RANKL system. which is responsible for activating the osteoclast. It is where they act. So all these drugs, they decrease the osteoclastic activity. So another group of drugs, they are called anabolic drugs. They are testosterone hormone, teriparatide. The new drug has come, but now not new. It is there for the last 15-20 years, available in India. And this drug helps in the new formation of the new bone and osteoblastic activity that is being increased. So this is the mechanism how we use this. Well, the type 2 osteoporosis, primary type 2, which is senile after the age of 65 in ladies and after the age of 70 in males. We prefer these drugs, teriparatide, because bone formation is less as compared to bone destruction. This rank is essential for the formation, activity, survival of osteoclast. So rank inhibitor is denosumab, which is very commonly used now. This is a monoclonal antibody approved with specified targets. It is a target therapy. It is a target therapy which is just like in cancer. So denosumab is used for rank inhibitor, and denosumab is also used in bone cancer also. And it is approved for post-menopausal, the patient who can afford, where we can give this denosumab. Otherwise, bisphosphonates, they also equally work. They are cost-effective, reduces the risk of vertebral and non-vertebral and hip fracture. Denosumab have got the unique effect that it reduces the chances of all these vertebral, non-vertebral. Whereas these bisphosphonates, they mostly prevent the vertebral fracture, and this increases both trabecular and cortical bone strength. And it is administered every once in a 6 month and suppresses bone resorption by 80 to 90%. So this is a very good drug and very common now. The person who can afford, we should prefer this drug. And the anabolic, which are used for formation of the bone, faster, better gain in bone mineral density improves 9 to 13%, reduces vertebral fracture, uncertain effect on hip and non-vertebral fracture. For hip and other parts of the body, usually the effect is not that much as is there in the spine, whether these are anabolic drugs or bisphosphonate or any group is there. Anabolic agents, I have already told you, they are teriparatide and another new drug, abaloparatide. This new drug has come, and both these drugs, teriparatide is usually given 20 microgram daily subcutaneous injection like insulin, and it goes for 2 years. It is not to be given for more than 2 years because after 2 years, it has got no effect. If we have to give, then after a very long gap, we can give. Sequential treatment, first we can give anti-resorptive treatment, then we can follow by giving a window period and then start anabolic agents. Or you first start the anabolic agent as per the patient and then start with anti-resorptive medicines and an anti-resorptive agent followed by another anti-resorptive. First we give like bisphosphonate, then we can switch on to denosumab like drugs. So this is the meaning of these things. Prevention is that prevention, we have to do our lifestyle changes, calcium, vitamin D, protein, exercise, and fall prevention. Fall prevention is that most of the time there should be proper light in the house. There should be no rags on the floor because अब आप पैदल चलेंगे, नीचे कोई पायदान पड़ा है, उसमें आपका पैर अगर उलझ जाएगा तो आप गिर जाएंगे, चांसेस हैं। तो ऐसी चीजें ना हो जो आपके चलने फिरने में रुकावट डालती हो। प्रॉपर रोशनी हो, बाथरूम में जहां आप नहाते हैं वहां पे दीवारों पे हैंडल लगे हों ताकि आप उसको पकड़ के उठ सकें। तो ये प्रिकॉशन जब लोगे तो जितना फॉल्स मिनिमम होगा उतना ही फ्रैक्चर होने का चांस भी कम हो जाएगा। मैं क्वेश्चन से पहले कुछ अपने स्लाइड्स दिखाऊंगा आपको, वो आप देख लेना, फिर उसके बाद में जो है, or you can start with the question. I have covered everything. Please start with your question answers.
Doctor, thank you for your overall on topic on osteoporosis. आपने सब highlight अपने on medication and all these things, but one thing that should be taken care with doctor advice. So uh, it's a well thought up on osteoporosis. सर मैंने ना दो तीन questions में देख रहा हूँ आया है. So सर
बताएं
ऐसा
बताएं.
है कि हाउ लॉन्ग शुड ए पर्सन टेक ऑस्टियोपोरोटिक मेडिकेशन? ऐसा कुछ है कि ऑस्टियोपोरोटिक मेडिकेशन मेरे को कितना दिन तक लेना है? समथिंग इसमें कुछ एनलाइटिंग.
ये ओस्टियोपोरोसिस की बीमारी जो है वो लाइक डायबिटीज और हाइपरटेंशन है. ये तो लाइफ लॉन्ग चलनी है अंडर द सुपरविजन ऑफ डॉक्टर. बीच बीच में हमें विंडो पीरियड्स देने पड़ते हैं ताकि ड्रग की टॉक्सिसिटी ना हो.
हाँ, करेक्ट करेक्ट. सो दैट इज वन पॉइंट. सर इसमें सम सीनियर सिटीजन आप में भी या घर में किसी का होगा तो एनीथिंग ऑस्टियोपोरोसिस रिलेटेड मींस मेरे को डायबिटीज है, सो कैन आई बीन प्रोन टू ऑस्टियोपोरोसिस या समथिंग? इसमें कुछ सर एनी थॉट ऑन दिस?
Yes, yes. Those who are diabetic patient, this concerns on the doctor and the patient also. The treating doctor for diabetes should advise the patient that you must get investigated as, especially after the age of 50 or 60. Be careful about osteoporosis also. So these diabetic patients, they usually have low bone mass, and for them we recommend the treatment. And as if you ask from me, my protocol
Correct,
is
sir.
that I don't depend blindly on the DEXA bone scan. If a
अच्छा.
patient is diabetic and I little bit look that sometimes though we say that patient is this is a painless disease, but if you see in depth, person will say doctor मेरी diabetes control रहती है तो मैं uncomfortable feel करता हूँ. Now these features when they occur, this is the warning sign that osteoporosis is there. Don't wait for actual fracture to occur. So that is my opinion.
Correct. That is a beautiful observation and opinion from your life experience. Doctor, इसमें someone is asking कि कैल्शियम एंड विटामिन डी खाने से मेरे को ऑस्टियोपोरोसिस नहीं होगा, ऐसा कुछ. देयर इज सम मिथ्स. आपको लगता है ऐसा कुछ है? क्योंकि दीज आर ऑल सम ओटीसी ड्रग, केमिस्ट
Yes,
पे
yes,
जाके
yes.
मिल जाता है.
ऐसा है. I tell you, कैल्शियम एंड विटामिन डी तो हर बच्चे बच्चे की जुबान पे है. जो भी मरीज हमारे पास आता है वो सबसे पहले मैं तो कैल्शियम विटामिन डी ले रहा हूँ जी. दैट्स वेरी गुड. इतनी अवेयरनेस तो आ गई सोसाइटी में कैल्शियम और विटामिन डी जरूरी है. बट after the age of 50, 60, when osteoporosis occur, only calcium and vitamin D will not work. You have to take some form of anti-osteoporotic medicine. They are in the form of bisphosphonate you take, or depending on the severity, we can give denosumab. Whatever the doctor likes, it is the choice of the doctor and the prevailing condition and the DEXA score reading. And one message I am giving again and again and again, don't follow the DEXA report blindly. And there are few diseases, just like rheumatoid arthritis. I have seen, I have not, because time is short, I cannot go more on this. Many patients of autoimmune diseases, they have never symptom in their life, and they suddenly present after the age of 70 or 65. The person will say कि doctor, and I have seen typically at least 50 patients I have seen. मैं सोचता हूँ कि ये इनको कैंसर तो नहीं है कहीं, और ultimately they are suffering from autoimmune disease along with osteoporosis, and in these cases the DEXA score is usually -4, -3. Very severe form of osteoporosis occur in these patients when there is a combination of autoimmune disease along with, and this I am telling specifically. If a patient is having rheumatoid arthritis, as the usual teaching is in the young patient, female patients, so they of course are diagnosed. But many people, they are coming after the age of 70, 65 for the first time. They are literally confined to bed, and most common symptom कि डॉक्टर साहब मेरे से बिस्तर से उठा ही नहीं जाता, रात को मैं करवट नहीं ले सकता, बिस्तर से उठता हूँ तो मेरे को 2 आदमी पकड़ के उठाते हैं. The spine becomes so weak. In these patients, you have to give a very aggressive form of treatment, both for rheumatoid and for osteoporosis. If you give for rheumatoid only, firstly, in these patients, it is very important to diagnose rheumatoid or autoimmune disorder. If you give treatment only for osteoporosis, person will not improve till you give treatment for rheumatoid or autoimmune disorder also. So this is a place where other disease is associated like diabetes, but when it is autoimmune disorder, treat both. Treat both, only then the person will improve. And the improvement is dramatic in these cases. Any other question?
Yeah, correct, doctor. Just one request. Just summarize something that for the benefit of the patient, some do's and don'ts, or how to take that risk case. That is the biggest risk. You already highlighted in your presentation and all these things.
But at the end, if you want me to summarize, then I will
Correct.
say only thing that over the years now it has been proved beyond any doubt that osteoporosis is a disease like diabetes mellitus or hypertension. Number one. Previously, it was the thinking was that it is a part of the aging process. No, it is not that. जब मैंने पहली बात कही थी कि अगर कोई मेरे दरवाजे पे दस्तक दे आधी रात को तो ईश्वर इतनी कृपा करना कि इस लायक बनाना कि मैं उठ के खुद दरवाजा खोलूं मेरे जीवन के अंतिम क्षण में। तो उसको करने के लिए हमें क्या है कि ऑस्टियोपोरोसिस का ट्रीटमेंट हमने प्रिज्यूम करना है कि इन पेशेंट्स को ऑस्टियोपोरोसिस का ट्रीटमेंट चाहिए। वो हमने कैसे सिलेक्ट करना है कि जैसे पेशेंट की एज के बाद 50-60 की एज के बाद जैसे लेडीज हैं उनके अंदर तो होता ही होता है, उनके अंदर अगर प्रिवेंटिव ट्रीटमेंट ही इनके लिए सबके लिए अच्छा है। जब फ्रैक्चर हो गया फिर तो आप दोगे। एंड जो आयरनी हमारे को जो दुख की बात ये है, both because of the doctor and both because of the patient also, even after a major fracture, 30-40% patients are still not given treatment for osteoporosis. And just like osteoporosis treatment is just like your diet. The calcium, vitamin D, and these drugs should be on your table. Take as the diet, don't take as medicine. Only then you can survive.
Correct, doctor. It's a best example you have shared from the dispensary level to the best of the hospitals and international speaker. So it is grateful that you have shared your time in this evening, approx 40-45 minutes. We are there. So we are in the fag end of the event. So as we conclude our session on osteoporosis, I want to thank everyone for the participation and engagement. And remember, already doctor shared osteoporosis is preventable and manageable with the right knowledge and proactive measures. So I will encourage everyone to, if you want to say face any problem or something like that, please visit your consultant. Dr. Khariwal is based at Dwarka, New Delhi. We get 3 decades of experience. So we encourage you to continue spreading awareness, doctor, and supporting those at risk. So together we can make a significant impact on bone health and quality of life. So stay informed, stay healthy, and thank you for being part of this important conversation. Request doctor, if possible, come after any 60-65 days again, we can talk upon some part of osteoporosis. But the best part, you have put your some good photographs so that we can check this what is there inside. And a hot topic is perfectly fine. You have shared one good pointed to everyone. So thank you, doctor. Thank you.
Just
All the best.
please share my phone number with your friends and other persons. If they have any query, they can talk to me in the evening from 7 to 8 p.m.
Definitely, we will share it. Thank you.
Thank you very much. Okay.